everyone. Happy Friday and welcome to NAMI Greater Los Angeles County. I am here with a few members of our amazing Connect with Hope team. I'm going to give everyone a minute or two to jump into the room and get settled in, and we will kick off our official Friday webinar. So welcome, everybody. Give everyone a minute to join us. Wonderful. Again, happy Friday. It is actually World Mental Health Day. So we're so excited to bring you this webinar as we kind of culminate the week of World Mental Health Awareness. I am excited to be here. Welcome again, and thank you so much for taking some time to join us today. I am thrilled to just share a part of our day with you. I am Donnell DeRubis. I am the Warmline team supervisor for NAMI Greater Los Angeles County. Our Warmline is called Connect with Hope. And I think as we share some of our inside sneak peek of who the Warmline is, you'll see why we are called Connect with Hope. Again, so excited to share part of our day today. We are here with NAMI Greater Los Angeles County. Throughout our chat today, you might hear us refer to that as GLAC. Just know that stands for Greater Los Angeles County. I am honored to lead and really partner with our staff and volunteers to bring the Connect with Hope Warmline resource to our community, to you, our community. And I'm thrilled to share with you that we have a few members of our team with us today. So if you want to just jump off mute and say hi to everyone who's joined us, we have Noah, who is one of our Connect with Hope peer support specialists. Thank you so much.
Good afternoon.
Yeah, awesome. We have Sabrina, who is also here with us.
Hi.
And we have Elizabeth, who you will hear leads our Spanish queue, which we're so excited to have available.
Hi, everyone.
Yeah, awesome. Thank you all so much for being here. You may have seen in your email that Vahe, which is one of our other team members, was going to join us today. Life happens, and so he will not be here, but that's okay. If you give us a call on the Warmline, you may very well be connected with Vahe. So let's just dive right in. Of course, first we have some kind of housekeeping rules. Just know this is a safe, respectful place. This webinar is going to be recorded. So if you're like me and you're taking in all this information, you might need to listen back to it. Don't worry, we will send the recording out to you. And for those of you who registered and then again, something happens, you're not able to be here live today, no worries, you will have the recording as well. If any of you have a question during the webinar, I'm going to ask that you just drop that into the Q&A section, question and answer section on your system. It should be at the bottom, and we'll set aside time at the very end to answer as many as we can. If we don't get to your question for some reason live, don't worry. We will follow up with everyone in email and get you that information. So those are our housekeeping rules, right? So World Mental Health Day, what is it all about? This is a really meaningful day, really a meaningful week, because it allows us to really shine light on something that is often overlooked. And by coming together today as a team, as a community, we're able to do that together. When we talk statistics, I just want to kind of remind you why statistics and numbers even matter. And that's because it's so evident that for any of us who may be living with a mental health condition, it's not just cliche to hear someone say, "You're not alone." The numbers prove that to us, right? And so each year, it's reported that 1 in 5 adults in the United States are living with a mental health condition. I want to kind of take that and step outside of that for a moment. These are those that have reported living with a mental health condition. How many more adults have not reported, but do in fact deal and live with a mental health condition each and every day? So that 1 in 5 may very well be more like 3 in 5 or 4 in 5. You have a whole community of people right here within NAMI Greater Los Angeles County and throughout all of the various affiliates and chapters with NAMI. Our goal is to build awareness, connection, and support. And I have to tell you, this is really where NAMI GLAC and its chapters really shine. We know that awareness is the first step. So we're very open. We talk about it. We promote various causes and things on our social media and through our newsletters and through the different programs. But we know that awareness alone isn't enough. We know that what really matters is connection. It's about creating safe spaces to talk, to be heard, and to feel understood. And as I share with you momentarily a little bit about the different programs and services we offer, I think you'll also agree this is where we shine. And we also know that each voice matters. Every time we talk openly about mental health, we together as a community start to chip away at the stigma and create that space to talk, be heard, and feel understood, which then creates hope and healing. And that's very much how the Connect with Hope team functions. All right. My hope is that everyone here today has heard of NAMI, perhaps before, NAMI Greater Los Angeles. Never fear. A little bit about us. We are an affiliate of the nation's largest grassroots mental health organization. So while we are NAMI Greater Los Angeles County and we support the very large community, we are an affiliate among many throughout the United States. As an organization, it is our goal to provide support, education, and advocacy for those who have been impacted by mental health conditions. That might be you personally, that might be you supporting a loved one, a friend, a family member. And we also want to reach the entire community at large because we know the more people that are educated on how to service and help somebody who may be struggling, the easier it is for that person to seek the hope and the healing that they so deserve. We do that through a variety of ways, which I get to share with you today. I also get to share with you some incredible events that we do because we love coming together as a community, and we do that through various events throughout the year. So again, I hope everybody here has attended a NAMI walk at some point in their lives, but don't worry because if you haven't, the 2026 NAMI walk will be launching soon. Follow us on our social media. I'll share with you our website many times today. All of the information for signups will begin soon, and we would love to have you be there. It is just such a beautiful day to come together as a community. We also offer an annual conference, which is actually coming up at the end of the month. We do presentations throughout the community, very similar to this today. There are presentations that NAMI GLAC offers throughout the year. So again, keep in touch with us through social media, get on our newsletter if you're not there yet, and then you can always visit us on our website, which is namiglac.org. And we have an online calendar that is up to date, so all of the presentations and events will be listed there. Our final big event is we do have a team that loves to run, and so they join the LA Marathon as Team NAMI. If you love to run or cheer, if you want to be in the cheer section, that's where you'll find me. So what is our mission here at NAMI? We're all about promoting wellness, recovery, equality, and dignity. We want to support, again, the individuals, their families, and the community at large. We just want to surround those who are dealing with a mental health condition with the support that they so deserve. One of the things that I find to be so unique and so very special about NAMI is we're a peer-led organization. So that means when you get to know your local chapter or here at Greater Los Angeles County, you learn that each of us have a personal connection, and the stories that brought us to NAMI is what really ties us all together. And again, I just find that to be very unique, very special. And that means whatever you're struggling with, NAMI can and will help you discover that you're not alone. We work really well together as a team. We collaborate. We are very diverse, and so we're able to really connect with each and every community. All right, so let's talk about us, your panelists. Who's here today? We are peer support specialists. This is a fairly new kind of role, but we're here to walk alongside people because we have firsthand experience. We know exactly what level of empathy we would want to feel We understand the need to feel seen, the desire to feel heard, and we have just real compassionate hearts that want to help you all figure out your next steps. Again, if it's you dealing with it personally or trying to help a loved one. Essentially, peer support equals lived experience. So we're just going to genuinely connect with you when you call into our warm line. We want to offer practical guidance. So we'll share our own coping strategies, things that have worked for us, things that haven't worked for us, whether that's breathing techniques, diet tips, exercise tips, different therapies, just various ways that we've managed to, find healing in our own journeys. We want to share that with you. And then the final piece to that puzzle is we want to connect you with our support groups that are across the county, and I will share more about those as well. We are trained and certified through a specialized program, so we are prepared to provide support in a really safe, professional, non-judgmental way. And this is, again, a really special program that we offer right here at NAMI Greater Los Angeles County. I would encourage you to visit namiglac.org, click on Get Involved, and then Peer Support Specialists so that you can learn a little bit more. And one of the ways we put our peer support specialist to work here is through our warm line. And that's where Noah, Sabrina, Elizabeth, and I, as well as a whole other group of amazing people, come together to serve you, our community members. So what is a warm line? We are a free, non-crisis support line. Again, we offer safe, confidential, understanding, non-judgmental space for everyday struggles. So maybe you're having a tough week or a tough day or a tough month, whatever it is, please reach out to us. Again, we're going to provide you with a safe, confidential space. Maybe that's you, or you're trying to support a loved one. We will talk to family members. We will talk to the community at large. So please reach out to us. We have dedicated staff, but we are also very much volunteer powered, which is so amazing. And each one of our peers brings just so much heart and energy. We get to meet on a weekly basis, and every time we hear from each other and share just kind of our experience over the last week, I'm always so grateful for the compassion that I hear in each and every one of our peers that just want to be there to serve you all. We are also a very diverse team. So again, we can connect with people from all walks of life and really understand more of each individual community's unique experiences. So we have Elizabeth, who is our Spanish Q. She manages and she is so ready to speak with anybody in the community who wants to speak in their native language of Spanish. So please reach out. We have members of the LGBTQ plus community. We have veterans, we have moms. We're a wide range of ages, life experiences. Some of us are living personally with a mental health condition. Some of us are caregivers for those living with a mental health condition. So again, we're just really a diverse team, and we're ready to serve every single community out there. I do want to provide just a little bit of clarity around what we do and what we don't do as a warm line, because there are a few differences. So we will always listen with empathy, that's for sure. We're here to share resources. So, and they may speak to it when we chat with them briefly here. We could provide housing resources, therapeutic resources, information on conservatorships, pretty much what you're looking for. We will try to find it for you if we don't already have it in our resource database. We will always, always follow up with you and never leave you wondering and without answers to your questions. What we don't do is provide therapy. We are not mental health professionals, so we are not going to become a therapist. We cannot diagnose you, and we do not handle emergencies or crises. If a call comes through that is leaning towards an emergency or a crisis, we will either refer you to 911 or 988, and 988 is the line for mental health crises. We do have the capability of helping you get to 911 or 988, but our best recommendation is if it's an emergency or crisis, go directly to 911 or 988. Any other call, we're here for you. All right, so how do you call us? How do you get a hold of us? We are open and available to you Monday through Friday from 10 a.m. to 8 p.m. Pacific Standard Time, and also on Saturdays from 10 a.m. to 2 p.m. I encourage you to jot down our phone number. If you want to speak with Elizabeth in our Spanish queue, please press 2. The system will guide you through all of this so you don't have to remember everything. You can also email us at hope@namiglac.org. You can also visit the website, namiglac.org/warmline. And again, we're available Monday through Friday as well as on Saturdays. If you reach us outside of the normal business hours, the system will allow you to leave a voicemail, and one of our peer support specialists will get back to you as quickly as they can. All right. I think you've all heard from me. Need to take a little break from me, and let's chat with a few of our peer supports. Sabrina, if I could have you come off mute. I have a few questions that I would love to ask you, and I think would be just a real value to our participants today. So thank you so much. I would love to hear what first inspired you to volunteer as a peer support specialist.
I would have to say that I have my personal lived experience. So many people in my life helped me, and they helped me with no strings attached. And although I could never repay those people directly, that's what inspired me to join the Warmline, because that they showed me such unconditional love and acceptance throughout my journey with mental health. I just want to return that
That's
to
amazing.
others.
Yeah, I love that. The pay it forward, right? Absolutely. That's amazing. How has being a part of NAMI, because we know you do many things here with us at NAMI, and then serving on the Warm Line, how has that actually impacted your own journey?
Oh, immensely. To keep my recovery, I see recovery or my journey. There's no end to it. It's for the rest of my life. It's continuous. It's up and down. Um, and with saying that, helping others really, it's kind of, it's really helping myself. You know, when I talk to somebody on the Warm Line and I listen, that's what's so important, is to listen, not just to, I let them lead the conversation, and give them that respect of a listening ear. And if there's something that I personally experienced that they're experiencing, I ask them if they would like me to share my experience. And that connection, that bond that we have with each other, I think that's the best type of healing.
Mm.
There, clinically, there's no match to that. Of course, there's medications, and I'm not trying to be negative about. I totally support, the doctors and all that. But having that shared experience with each other, I feel that's where the healing really starts to work.
Yeah, I agree. And I love that we get to come alongside and just be a part of their healing journey, right? And everyone's looks different, exactly what you said. And so, whatever the rest of their treatment plan might look like, we just kind of fit right in wherever they're at. So I love that. Thank you for sharing that. I have one more for you, if that's okay. What's one thing that you would just like to remind anyone who might be here today listening who also may be struggling?
Even though it feels that you're alone and maybe struggling with hope, know that you're never alone and that we're here to provide you the support that you need and the resources. And, call us because you'd be amazed at what we can provide you. And if you don't have hope, it's okay. We'll hold your hope until you have hope. Mm. And with NAMI, that's what's really important. And if you get involved with our support groups and things, it's even in our guidelines, in our principles of support, that that we'll always have hope.
Oh, I love that. Thank you. I think that's such a beautiful reminder, and just I hope everyone takes that as an encouragement. I've actually heard Noah say that before, like, I'll hold the space for you until you're able to do that for yourself. So I love that. Thank you. Awesome. All right, Elizabeth, if I can have you come off mute, and I have a few questions for you too. Can you just share, just briefly, a little bit about your personal journey and what led you to get involved as a peer?
Hi, I actually worked before on the mental health, and as a part of the intake department, I was able to hear a lot of stories. But unfortunately, there was more paperwork that I have to do than actually be an active listener. When I hear about the opportunity to be with NAMI, I saw the opportunity to actually connect and be empathized about the situations they might be going through, which is different than just get the information to get them ready for therapy. So the passion that I have, especially to help those ones that have not learned yet the language to speak English, and help them in their own language, which will be Spanish in this case, is a great opportunity that I encounter, that I feel so um, thankful to be able to do that for the community.
Yeah, that's awesome. Thank you so much. And we're so thrilled to be able to offer that as well. What has been the most rewarding part of being on the warm line?
I would say that part when I can actually be an active listener and not just actually asking questions that they don't want to actually answer at that moment, because when they call us, and that's what I let everyone know, they want to be listened. They sometimes they just got those calls that like, can I just talk? And I'm like, offer that space and actually listening and actually connecting with what they're feeling. And later on, if they actually want my opinion or my advice, be able to give them that advice, because I might went through the same or heard about the same situations. That's what actually gets me, more than anything into this line.
That's awesome. Yeah, I agree. I think sometimes yeah, we just need an unbiased, safe space to just kind of let everything out. And I love both you and Sabrina both said, we're just here to listen. So don't feel like if you're calling the warm line, we're going to try to magically poof make everything better. We certainly wish we could do that. That's not our role, but our role is to, yeah, just as you both said, just be active listeners, offer guidance when it's needed and wanted, and just become a friend. And I think that's really special. What do you see some of the benefits of connecting with a peer? Like, why would somebody want to connect with us?
Well, I would say one of the benefits of our line, we hear, and this is confidential. Nowadays, especially right now with the Latino community, there's a little of fear for different situations. And if they don't want to just give all that information, just want to say like my name is Tom, or whatever they want to say, that's okay. We're not going to question them. We're not going to track them or anything like that. So that fact that they can have a confidential safe space to talk, that's a big plus for this line. You want to actually connect with our line, because no matter what you want to say, we are here to hear you. And if you want to get some resource, we got to do everything in our hands to go ahead and give you those resources. Especially if, like I would say, for the team, every time that we connect every month, every weekly, they're like, hey, they asked for this. And then the passion that I would say we, including Donnell, that we want to go ahead and find those resources and then provide the information. It's something that you can make sure that you will actually get. You will get the best from us, and then we will here to hear you, no matter what the situation may be.
That's awesome. Yeah, and I want to reiterate that. Thank you so much for sharing that. I really appreciate it. And you're right. That's a really important key that I want everyone to know. You can call into us and remain anonymous if that's your choosing. You don't have to provide us with your name, your phone number, your email, any of that, unless it's something you desire. So know that, yes, you can contact us very confidentially. And as far as resources are concerned, again, we have a great database full of resources, but sometimes we don't have the answer right off the top. And so just know that we're going to go that extra mile and we're going to follow up with you. So whether that means we reach out to our team directly, reach out to other colleagues and leads within NAMI Greater Los Angeles, just know that we're going to do our very best to find you the resource that you're looking for and try to fit that resource to your situation to the best of our ability. And if we can't for some reason, we're going to let you know that as well. So we're not going to just leave things hanging. We want to go that extra mile because we would want somebody to do that for us, right? Bottom line. Yeah, awesome. Thank you so much, Elizabeth. I appreciate it. All right, so let's learn about some other ways NAMI supports you. We are, again, just about creating connection, and one of the greatest ways and best ways is through our peer and family support groups. So these are no-cost support groups. Again, they are safe, confidential, and peer-led. Again, such unique elements of who NAMI is. We offer a variety of groups. I'm only going to highlight a few here, but you can see in bold on my slide. Head over to our website, namiglac.org/support groups. So we have what we call Connections. Connections is a support group for anyone over the age of 18 with a mental health condition. So that's you're dealing with a mental health condition and you want to connect with other people that may be dealing with something similar. We also have our family support groups, again, for anyone over the age of 18 who want to come and be supported because you're supporting somebody with a mental health condition. And we know the incredible strength and energy and time that takes, and we want to be a support to you as well. We also offer identity-specific groups. We have Spanish groups, Japanese groups, our LGBTQ plus group, which Noah runs, our women of color. I mean, we want to touch every possible community that we can and ensure that everyone knows that they have a safe space to come. We also have a fire-affected support group. So for anyone that was impacted and continues to be impacted by the 2025 LA wildfires, please know we have a group specific for you as well. And we know within each of these, there's just different dynamics. And so we do our best to bring you into a space where you're going to be with very like-minded people. All of our groups are offered either virtually, also in person, pretty much every day of the week. I was actually looking at the calendar and I think we're there. I think we've hit every day of the week. So you can literally get supported by NAMI GLAC every day of the week. You can join us virtually or in person. Some of our chapters only have virtual, some have some virtual, some in person. So again, visit the website, namiglac.org/support groups. And while we might encourage you to join a group that's closest to where you live, just know that because so many are offered virtually, that means you can also attend one that's outside of your area. So don't feel like you can't join a group if you're not able to meet on the day that your chapter offers a group. We also offer peer and family education. So a little bit different to the support groups, our peer and family education actually run about 8 weeks long. The support groups are continuous week after week after week without an end date. But we also offer no-cost education classes to provide you with just the understanding of mental health as a whole. We provide skills training, support, resources, And again, we break it up to ensure that you're kind of within a group that makes sense for what you're dealing with. So we have our peer-to-peer, anyone over 18 with a mental health condition, family to family, anyone over 18 who supports somebody with a mental health condition. And then we have our basics. So this is for family members and caregivers who provide care for children under 22 that are experiencing mental health symptoms. The classes do meet weekly for about 2 to 2.5 hours. Again, some virtual, some in person. They're also offered in Spanish, and these run typically 8 weeks. So when you do sign up, we ask you to commit to that 8 weeks so that you can really absorb all the value that you're going to receive within those classes. All right. We do community events, and I'm so excited because we have one coming up. But I want to just share a couple of them with you. Now would be a great time to get your iPhones out or your phones out and take a picture of those QR codes and register. So we do have a team that runs for the LA Marathon. It is Team NAMI. You can register if you're into running, you want to support it in that way. There is still space available. If you want to register and support and help raise funds, you can also join us at the cheer section. We have one of the affiliates who brings out a whole speaker system. We just have a really, really good time coming together to cheer on our team, Team NAMI. So grab that QR code. We also have the NAMI Greater Los Angeles County Conference. That is actually coming up on Tuesday, October 28th. Again, I encourage you to scan the QR code and register. Join us. It is a day of, you will just walk away with so much more knowledge and so many more connections to various professionals throughout the community, learning so many different ways that you can support loved ones, so many ways that you can continue your own hope and healing journey. So please join us. It's a really, really beautiful day. Lunch is served. We all love food. I say join. All right. So now is the time as we wrap up with our NAMI overview, our warm line, all the ways you can get involved, learning about our support groups. Again, we just thank you so much for taking the time to learn and connect today. And I'd love to open it up for any questions. So if you want to drop those in the Q&A box on your system, that would be great. And Noah, you let me know if you see any in there for me. And I'm going to leave this slide up for you. This is just some ways that you can connect with us. I think you all know our website now. I've said it a few times, so namiglac.org. You can, I encourage you just to go play around on the website. We have our calendar, we have our list of events, ways to join the support groups, all of the advocacy work we do, information about the Warm Line, everything is right there. So I really encourage you to connect there. And then if you're not following us on social media, we're doing all the social media things, so please make sure you give us a follow. Our office phone number and our website is all listed here. So please jot that all down. Do we see any questions? Let's see. Noah, do you have any questions in the
Oh,
box?
yes.
Okay.
We have 3 questions.
Awesome.
So the first question is from Kayla. How do I, or what are the steps to become a peer support specialist?
Great question. I was hoping somebody was going to ask that. Yes. So there is some criteria that needs to be met. Again, there needs to be a personal connection, whether that's you living with a mental health condition or that you've supported a loved one. And I would then encourage you to actually visit our website, namiglac.org. At the top, under Get Involved, there is a link for peer support specialists. All of the information, as well as how to contact our program manager and get enrolled, is on that page. It does require an 80-hour training, which goes over about a 2.5-week period in the evenings. It's just an opportunity to really dive deeper into the various mental health conditions, resources, how you will interact, should you pursue either a volunteer or career as a peer support specialist. But it is a program that is offered by NAMI GLAC, so I encourage you to visit the website. Absolutely. Great question.
We have another one.
Mm-hmm.
Along the lines of peer support specialists, I believe you covered most of the information, but I'll read their question really quick. I'm curious to hear a bit more about what a peer support specialist is. Can you talk more about the training they receive? What is the process like? And why are people who become a peer support specialist good for the warm?
Awesome. Yeah. Again, I would encourage you to visit the website. And Noah, Sabrina, Elizabeth, feel free to chime in if you want to add to this as well. It does require the 80 hours of training. And at the end of that, you become certified as long as you've attended all of everything. And quite honestly, from a Warmline perspective, or really just volunteering or pursuing a career in this, I will tell you there are lots of organizations and companies that are really kind of following the path of bringing on peer support to their staff, to their organization. And I think Sabrina mentioned there is something quite special when you get to connect with somebody who gets it. Like they've lived it. They've walked through very similar or perhaps even the exact same situation. And just being able to, just have the approach of somebody who's going to listen without judgment, somebody who, again, knows what they would want, right? Like we've all received care and hope and healing from people in our lives, and we just want to serve our community in that same way. And again, I think we just fit alongside so beautifully with whatever anyone's treatment plan is, whatever that looks like. We get to come along, like maybe that friend you don't have, right? To just provide you support and guidance. So that's really the value of a peer support. But as far as being like on our Warmline as a staff or volunteer, and I think for many organizations, you do have to complete the peer support training first. I hope I addressed all of that. Yeah.
We have another question. I believe that you really touched on all the bases, Donnell.
Mm-hmm.
Question again is, what is the training to become a peer specialist? The question was from an anonymous attendee, and if you feel that the question was answered, to meet your needs, feel free to chime in the question and answer to state whether that was sufficient information for you. And so the next question is, do any of the NAMI groups still meet in person?
They do. Yeah.
They
do
do.
it.
Yeah,
go.
they do. Some of the connections groups do meet in person, and the family-to-family support groups, and also the education groups. They do meet in person. If you go to our website again, namiglac.org, and click on our calendar, you could see up-to-date information on virtual and also in-person groups.
Yeah, great question.
And then also, Gigi has something about the conference. The conference is at capacity. So we could add you to a wait list. So yeah, feel free to, if you have any questions about that, you could, also send us an email or call our Warmline for more clarification on that.
Yeah, thank you, Gigi. I appreciate that. Yeah, if anybody is still interested and wants to at least join the wait list, which I think just knowing that shows you the power of the conference and why it's such an amazing event. You can email info@namiglic.org and we can provide you with how to get registered and be put on the wait list. Absolutely. Thank you, Gigi.
Another question here. We have a few more. Oh, yeah, we're getting the questions. So this is for Jeanette. They are currently a peer support specialist. They just got certified. They are curious to where they could apply for the Warmline work with the Connect with Hope Warmline?
Yeah, absolutely. Great question. So we do have it's, as I mentioned previously, very volunteer powered, which we're so very grateful for. So we are open to bringing in more volunteers. If you want to, again, you can email info@namiglac.org. You can contact the Warm Line. Whatever works best for you. I'm not sure if you completed the program through NAMI, and if so, you can also connect with the program manager, Yvonne, and she can also get you connected. There is a little bit of an onboarding process, which everyone here is very familiar with, and we just kind of take you through. We give you additional training. We work through scenarios. You get to meet the team, and then we put you on the schedule, and it can vary as far as what's available on the schedule, just depending on what the needs are. But again, we're available Monday through Friday from 10 to 8, so there's a lot of flexibility there, as well as Saturdays 10 to 2.
All right. I just want to mention about basics, our basics class. So the basics class is a free 6-week course for parents and other caregivers of children and adolescents living with mental illness. And if you go to our website again, you can check out when these classes will begin. And we have another one here. Do peer support specialists have specialties such as schizophrenia or borderline personality disorder? Can I answer that?
You can.
I think we don't necessarily disclose unless we feel the need to. But yes, we do have lived experiences. I can't say which specific disorder, but I think through the Warm Line, again, as a peer who has lived condition, when the time is right or it's feel it's appropriate to start addressing that type of connection, we sure will be able to be there in that way.
Yeah, absolutely. And just going back to kind of the beginning, as a team, we're very diverse. And so, anytime somebody calls into the Warm Line, you may be speaking with Noah, who has their personal experience. You may speak with Sabrina, and she has her personal experience. And so, again, there's just such a diverse representation here. But yes, again, just as Noah said, we all have our own experience, whether that's personally or as a caregiver of somebody. Great question.
Another question here is, will insurance ever cover peer support as a treatment? Are you or is NAMI doing any advocacy for this?
That's actually a really good question. I will have to follow up, to be honest with you, on the advocacy piece. I know the peer support program itself is generally pretty new. It hasn't been around for very long. And so let me do a little follow-up on that just to understand kind of the direction NAMI might be taking, as well as just as a state and from an insurance perspective. And I will be sure to include that response in the email we send out with the recording.
All right, we have another question. We have a little more time to get to these. Mm-hmm. So do you receive calls mostly from LA or are they all over?
Another great question. These are so good. I love it. So while we support Greater Los Angeles County, really that means we're going to be the most familiar with the resources and, of course, the geography of Los Angeles. We do actually receive calls from even out of state. 99% of the time, those are for family members who are trying to assist a loved one that's in Los Angeles. If they're seeking help kind of outside of the Los Angeles area, we will generally connect them back to their local NAMI or the closest NAMI to them. But yes, we will, of course, take their calls and do everything we can to assist them. But again, we try to focus on the loved ones that are here in the Los Angeles area.
Another one here. It is information about on our website about to become a peer support specialist. So maybe we could add that in the follow-up It's namiglac.org/get-involved/peer-support-specialist. So that's more information there. And then we also have the Catalina Jazz fundraiser that we're having as well. And so we have the website here. You can go on namiglac.org for more information about that. It's a really, really fun event. We have like celebrity people who do support and perform. Jane Lynch, I believe, is one of them. So yeah, it's a fun time. Please check it out on our website.
Yes, all of our events are listed on our calendar, and that is, all of our events, everyone, we know how to have fun. Let me just tell you that. But we also know how to come together and just create just such a sense of community. So please, yes, hit namiglac.org and go to our calendar so that you can join all of our events.
So we have some comments here. This one is from anonymous attendee. So they had to say, peer support, it's their personal opinion. Peer support is incredibly powerful and one of the most underutilized parts of supporting anyone's mental health. Thank you. Love what you're doing. We need more. But yeah, really appreciate it.
Yeah.
All the help we can get. And then there is this question. This is Lana Sawyer. This is Lana Sawyer from NAMI Ventura County. I guess it's more of a question. It says here, I registered to attend, but I had the home support services provider work with me until 12:30. Yes, we are recording this, so everyone who has attended will be receiving a video of this webinar and also the slides as well. And any of the information or questions that have not been answered will be answered in an email in the follow-up response with all this, the video, the slides, and any of the questions that have not been answered. So Lana, you should be receiving that follow-up after within the week. So.
Perfect.
And lastly, this is thank you, Martha, for this. Mine is not a question, but I appreciate if you can mention. Oh, thank you for Elizabeth. This is for you. Thank you so much for having the warm line in Spanish. So that it's very important for sure.
Yes.
Thank you, Martha.
I think it's NAMI that actually I will say thank you to in order, to try to cover, like I say, the LGBT community, Spanish community. I believe in, they also have Tangalo, some classes in Tangalo. So NAMI is actually looking to go ahead and, cover all the needs and all the populations. So I'll say thank you so much, NAMI, and the opportunity to be here and help the Spanish community as well.
Awesome.
We have time for one more question. One more. So this one is from Doug. Do all NAMI chapters offer the same services? How about outside the different NAMIs, specifically New York? I guess they vary. They vary from chapter to chapter, each affiliate. So you can always find out our information at namiglac.org, and you could follow up with looking up NAMI, I think Metro New York .org. I'm not sure 100% sure about that website, but if you do a quick Google search, you could pull up their information or search their social media page.
You can also do just NAMI.org. That's the national site, and you'll be able to find your local state affiliate there. And then each affiliate and chapter actually have their own website. Obviously, we're very familiar with the greater Los Angeles County, and so we put all of our programs, services, events, and everything on a calendar there. Of course, we would hope that to be the same across the board, but that would be the best way to find your local state affiliate is through NAMI.org. Awesome. I think that was the last one.
Yes, actually, there's one more. I think this is NAMI. It says NAMI OC Warmline is 24/7. Do we plan on going 24 hours, 7 days a week?
That is a possibility. I'll leave it there and just again encourage you all to stay connected with us as we do expand and create shifts and changes and things of that nature. You can always find that on our website through our social media and staying connected through our newsletter as well. But that is a possibility. So thank you for throwing that out there. I appreciate it. Amazing. I just want to say thank you to everyone for again taking time today. I know everybody's calendars are very full. I hope everybody has a beautiful, blessed weekend. Thank you to Noah, Sabrina, and Elizabeth for all being here and for your hearts to serve our community as a part of the Connect with Hope Warmline. We are just so grateful for you. Thank you, everyone, and hopefully we will see you at the conference, marathon, a walk. We'll see you all soon. Take care.